Immunotherapy. It's become a buzzword in oncology over the last 5 or so years. Oncologists are fielding more questions about this new treatment type from patients who have heard about it online or in the news. But what is immunotherapy, and what type of cancer could it help to treat? Dr Nick Zdenkowski is the medical advisor at Breast Cancer Trials. He says immunotherapy is the ultimate in personalised medicine.
Personalised medicine has up until now been useful for only certain selected patients. Immunotherapy also is useful for selected patients, but what it does is it allows the immune system of that individual to deal with the cancer. So delving a bit deeper into it, cancer is really good at avoiding control by the immune system. It essentially hides. And that means that we need to use other things to try and attack that cancer. But with the invention of immunotherapy, it is taking the brakes off the immune system. So it's getting that cancer to become visible to the immune system so that the immune system can then attack it.
Immunotherapy is only appropriate for certain patients with certain types of cancers and tumours. It can be given either in combination with chemotherapy, but most commonly it's used on its own.
What we've realised is that only certain tumour types respond really well to immunotherapy, and there are some for whom immunotherapy is less important. We've seen more recently some good data in breast cancer. There are certain types of breast cancer that seem to respond a lot better than others. We know that breast cancer is made up of a range of different tumour types, and the estrogen, progesterone and HER2 receptors are very important in classifying those breast cancers. The breast cancers that are most susceptible to immunotherapy are triple negative and HER2 positive.
Dr Zdenkowski says he has personally seen an uptake in questions about the treatment from patients who have heard about it being used in other cancer types.
I'm a practicing medical oncologist part of the time, and I see a lot of patients who are asking about these drugs, and it's difficult to respond at present because it's not available in Australia for the treatment of breast cancer in routine practice. Patients see other cancer types and they hear about people who have received immunotherapy, and it's been in the press quite a lot. So I think a lot of the time they don't appreciate how different the different cancer types are, and even within breast cancer they don't appreciate how different the different breast cancer types are.
These different cancer types include melanoma, lung cancer and bladder cancer. Immunotherapy proved incredibly successful for these cancer types.
It started out in melanoma, and that's where we saw some amazing results with trials showing quite durable responses. And for some of those patients, the melanoma just melted away, which has never been seen before in melanoma and many other solid organ tumours. And then after the melanoma data came out, we saw more and more in that tumour type, as well as expanding out into the lung cancer and urological cancer fields.
On the back of this research, Breast Cancer Trials has launched 2 new clinical trials, CHARIOT and DIAmOND. Both trials will use immunotherapy as part of the treatment for trial patients. CHARIOT will be open to women and men with early-stage triple-negative breast cancer and aims to identify a new treatment that is safe and effective for tumours that are resistant to traditional chemotherapy. Trial participants will receive a combination of the drugs ipilimumab and nivolumab with weekly paclitaxel before surgery and treatment with nivolumab after surgery.
So we've seen a few trials already reported on immunotherapy in breast cancer, and we've realised that it's probably better off to be given relatively early since the time of diagnosis. The CHARIOT trial is a trial that's looking at the neoadjuvant setting, and that means that the patients who've got breast cancer that could be removed by surgery, but they're having chemotherapy before that surgery to try and reduce the size of the cancer and to allow them to have the best chance of surgery removing that cancer. CHARIOT takes patients with triple negative breast cancer, and if they've had an incomplete response halfway through their chemotherapy, they're then put onto the trial and are given a dual immunotherapy plus chemotherapy. This is in the hope of stimulating a response in cancer that is resistant to traditional chemotherapy agents. So we see that breast cancer sometimes responds really well to chemotherapy, and that's great. But the patients who don't respond have a poor prognosis, and we want to turn that around. We want to improve those patients' prognoses.
The DIAmOND clinical trial aims to improve outcomes for patients with metastatic breast cancer by researching the side effects, safety and effectiveness of a new drug combination. Despite recent advances in HER2-targeted therapy, there are major limitations to current treatments, with most patients developing resistance and some types of HER2-positive disease not responding to conventional chemotherapy.
The DIAmOND study is looking at taking patients with metastatic HER2-positive breast cancer to induce a response and disease control for as long as possible, and with the hope that some of those patients will achieve a very durable response similar to that seen in patients with melanoma and lung cancer.
The trial will examine whether the combination of trastuzumab, an anti-HER2 therapy, with durvalumab, a PD-L1 inhibitor, with tremelimumab, a CTLA-4 inhibitor, will reactivate anti-tumour immune response and improve clinical outcomes in patients with trastuzumab-resistant advanced HER2-positive breast cancer. To find out more about CHARIOT and DIAmOND, visit our website at www.breastcancertrials.org.au or speak to your doctor about whether you are eligible to participate in these trials.